Mr. Speaker, I rise today to share with you in the House of Representatives real stories of people from Colorado and their experiences with health care and why we need to pass health care reform now. One woman from Colorado who told me her story and asked that her name not be shared had a son who was born with diaphragmatic hernia in 1987. He received emergency surgery shortly after birth, and although the first 5 years he had several related hospital stays, he grew up a pretty healthy kid. At that time, this woman didn't have to worry about whether or not insurance would pay for the treatment he needed. He received the very best care through their health provider. But 2 years ago, their son started having chest pains, difficulty breathing, and was developing problems with his spine. He was a junior in college at the time, and he was trying hard to keep on top of his studies and not be impacted by poor health. He saw several doctors who all said he had a condition that might have been related to his initial surgery at birth that needed an operation to correct the abnormality. But his mother's insurance company, Cigna, refused to approve the surgery 3 times over a year and a half, claiming that his health was not compromised enough. Certainly doing thoracic surgery on someone whose health is compromised is an incredibly bad idea. Fortunately, they were finally able to obtain Cigna's approval when the president of the hospital and chief surgeon contacted the Cigna representative and discussed the case. Fortunately, his health didn't deteriorate during the year-and-a-half wait, and after the surgery in March, recovered pretty easily. How many people like this young man don't have parents who are able to be aggressive advocates for them? What if his mother didn't have a high school education, was just learning English? What if his mother wasn't with us? What if that year and a half had made the difference between a lifetime of incapacitation and a productive, healthy lifetime for this young man? That is why we need to pass comprehensive health care reform, ban pricing discrimination based on pre-existing conditions, create more real competition in the insurance industry so insurers that routinely exclude coverage and fight the very people that they are there to help lose business to others who are willing to pass more of those patient premiums back to their patients in the form of health care. Thank you, Mr. Speaker.